So let's talk about contraception for new women right now, right? So for new moms, what are the options available?
See, the contraception to me is something which the woman or the couple should take it as a responsibility. The problem is not that they are not aware of contraceptives. The problem is they are inhibited to use them. So there's a lot of awareness needed to break these myths about contraception. There are many contraceptions available, and for new moms, the one of the best contraception available is in form of a intrauterine copper-T. That's the intrauterine device. Because the new moms, the challenge is that you have to take care of the newborn, you have to take care of yourself, you have to take care of the household as well as work, and contraception then takes a back seat. So if there's something which is there, which is taking care of itself on its own, then you really don't have to bother. First of all, for the new moms, pills cannot be started in the first 6 months. The usual pills, the combined contraception pills, cannot be started in the first 6 months because it affects the quality and the quantity of the milk. So it needs to be started at least 6 months later. In these 6 months, they can start the single dose pill, or in 4 weeks after delivery, they can just insert a copper-T, forget about it for the next 3 years.
So since you've mentioned copper-T, what is copper-T and is it safe?
Yeah, so copper-T is a very age-old contraceptive. It's in form of a very small device, and it goes into the uterus, into the womb, and it basically makes the environment unfriendly for a baby to grow. There are simple copper-Ts, there are hormonal loops also available. Hormonal loops, of course, are much better in contraception. Simple copper-Ts are also good in contraception. They are for 3 years, 5 years, 10 years. So as long as you want to have the gap or have an interval, these are fantastic long-acting contraception available.
So what's the most popular contraceptive used by moms?
Pills, 6 months later. But copper-T is, of course, definitely
a better option,
especially with the hormonal loop which has come out, which is also taking care of the menstrual blood, because you bleed very less.
Does it really cause mood swings, and is it safe and a viable
whenever
option?
You start pills, it's a hormone.
Correct.
Of course, the hormones in the pills are the hormones which are already in your body.
Okay.
So it's not that it's going to completely be different in your body, but of course it has to, because it is given in a dose which the body is not used to. So it takes a little time to get adjusted. During
Correct.
that time, you might have some side effects like the mood swings. Slowly, over a period of time, let's say 2-3 months of continuous usage, these all go down.
Okay, is it a viable option, or would you still suggest copper-T for everybody?
I would prefer, that's my first recommendation, the copper-T or the hormonal loop. The hormonal loop is my first preference. Second is copper-T. Third is the pill.
Okay.
The problem with the pill for the new moms, you're talking about new moms, right? It has to be taken every day at the same time.
Correct.
Okay. So for a new mom, the challenge of remembering that
and keeping a track of it.
Yes,
correct. Correct.
So we have hormonal rings available now. So that can be changed once in 3 weeks. That's also a viable option.
What are the exercises new moms need to do right after the surgery to bounce back to health?
I feel exercise should start right as soon as you get pregnant. So it continues after that, because fitness cannot start suddenly. After you give birth and you have already gained too much weight and things like that. So it needs to be started, it needs to start from early pregnancy, and it needs to be continued. The trick is to start gradually and slowly build up your exercise levels to the levels where you are
initially. What are Kegels? Like you mentioned right now, it's one of the things that you should do, but what are they?
Kegels are basically to strengthen the muscles which support the womb the intestines, the bladder, the water bag, and the stool bag
Correct.
in our body.
Correct.
So during a delivery or during even a pregnancy, it's not a normal delivery. Even after cesarean, the pelvic floor muscles which support these vital organs become loose. So it's the pregnancy itself which makes them loose.
Correct.
So in that case, you need to do some exercise to contract those muscles and relax. There's a definite technique how you do it. So one should go to the healthcare provider and ask for that particular technique. That's not to be done to relax and contract. It's not that. You have to contract those particular muscles. There's a way of identifying those muscles, and then contract, hold on for about 10 seconds and slowly release it.
Correct.
So it strengthens the muscles and it keeps the womb and the water bag in position. Otherwise, what we end up in having is something which we call as a prolapse, that the womb comes down and the water bag comes down. There has to be a difference between a woman who is getting pregnant at 25 and at 35. So the first pregnancy I'm talking about.
Of course.
Right? And by the age of 35, there are certain gynecological things that come into being which was not at 25. For example, fibroids. So fibroids are benign growths in the tumor, in the walls of the womb, which are, as I said, essentially benign. They are not like malignant tumor. They are not cancerous tumors, but they are very common. Like 25 out of 100 women will have it.
Of course.
And post 30s, it's more common. So by the age of 35, 37, you see more women with fibroids wanting to get pregnant.
Fibroids affect chances of having a baby?
Fibroids per se does not really matter.
Correct.
Until and unless they are in a place which can interfere with the implantation, that is hooking of the baby with in the lining of the womb. So suppose it's a big fibroid in the lining of the womb and it's occupying the whole space, so there's no place for the baby
Correct.
to come and get hooked. That's one. Sometimes very big fibroids can interfere. Otherwise, small asymptomatic fibroids usually don't interfere.
What are the symptoms of fibroids? Common symptoms that you can know?
Fibroids, the most common symptom is heavy bleeding, and there can also be pressure symptoms if they are very big. You can, one can have pressure symptoms of going frequently to the loo to pass urine, and also there can be a dull ache in the lower tummy. But most of the fibroids are detected incidentally. When
correct.
they are doing a sonography for something else, they are detected with a big fibroid which they have not
known.
Not known.
What are the typical reasons of not being able to conceive?
Age. Nowadays, the stress of life, of course, has tremendous influence on the couple, and of course, environmental toxins have added on to the ovarian function, and the ovaries age much faster in Indian women. So if you see a American women conceiving or a Nigerian woman conceiving easily at 49, easily at 44 or 45, it's not that same with Indian
women.
There are infections, there are male factors, there are hormonal imbalances like PCOS, which is a major contributing factor for infertility, for not conceiving.